to Science University of TCM. Today we will go on our study of moxibustion. Today's lecture is about moxibustion with moxa sticks. Moxibustion with moxa sticks. This operation refers to make the moxa stick like and applied on certain parts. Moxibustion with moxa sticks includes two kinds: the suspended and pressing moxibustion. Let's talk about it one by one. The suspended moxibustion manipulation. This method is done by holding the moxa stick over the acupoint during treatment. It's important to note that the end of the moxa stick should not make contact with the skin. It is subdivided into mild warming, spiral packing, and weaving moxibustion. Wheeled moxibustion. One end of a moxa stick is ignited and held over an acupoint or air. The distance between the end of the stick and the skin should be about 2 or 3 centimeters. The intention here is to bring warmth to the treatment area, so the patient should not feel any burning sensations. The practitioner should place their index and middle fingers on the sides of affected area to feel the heat, so that they can determine and adjust the appropriate distance between the end of the stick and the patient's skin to avoid burning for patients in a coma or who have delayed or impaired sensory perception. Packing moxibustion. With this method, the distance between the ignited end of a moxa stick and the patient's skin is not fixed. Instead, as its name indicates, it is moved up and down over the point or air like a packing board. Weaving moxibustion. When using this method, though the end of the moxa stick is kept 2 or 3 centimeters above the skin, it is moved back and forth or circularly. Okay, let's have a look about the suspended moxibustion manipulation. The second is pressing moxibustion. This method is moxibustion is done by pressing the burning end of a moxa stick, participated off by several layers of cloth or cotton paper, on the acupoint to allow the heat to penetrate the skin and muscle. After the fire is extinguished, it should be ignited again and repeated. The third chapter of 受欲神方, the magic prescription, not only recorded this method, but also mentioned that it is used for treating patients until they feel warmth in the abdomen with sweating. Then the patient will be healed. 太乙 moxa stick and thunder fair moxibustion is commonly used as pressing moxibustion. 太乙 moxa stick ingredients generally such as 人参、千年剑、钻地蜂、肉桂 and so on. Grind them all into a fine powder. Then mix 24 grams of the powder with 150 grams of pure fine moxa tightly roll the mixture into a stick with a piece of mulberry paper, 40 cm by 40 cm, shaped like a firecracker. Finally, paint the outside with some egg white and dry the sticks in a cool, ventilated place. The manipulation is the same to pressing maxi-busing. There is another option for doing this kind of maxi-busing. Cover the parts of the body to be treated with several layers of cotton paper or cloth, and quickly press the ignited end of a maxi stick and lift it up rapidly. This is repeated several times, and when the heat decreases, another maxi stick is used for the same procedure. Generally, it is done 10 times for each acupoint until the air treated is flushed. The penetrating heat is sustained. Practitioners should be aware of anything that might catch fire during this procedure. It is effective for treating wind, cold, damp bee syndrome, intractable numbness of the body, atrophy, and hemiplegia. Thunder fire maxi-busing. The method of making maxi stick is the same as that of the Tai maxi stick. Maxi-busing except that the ingredients are different. The procedure is also similar to that of Tai maxi stick maxi-busing too. Warm needle maxi-busing. 温针灸. Warm needle maxi-busing is actually a combination of acupuncture and maxi-busing. During the manipulation, after the arrival of qi, while the needle is still retained in the point, affix a small section of maxi stick on the needle's handle, and then ignite the maxi stick from its bottom. When the maxi stick burns out, remove the ash and take out the needle. This method is used when both retaining needles and maxi-busing is indicated. Maxi-busing with a maxi burner. The milled maxi-businger is a special instrument used for maxi-busing. There are two kinds, the box and the canister. Both are commonly used in clinical practice. To use, put some maxi oil, either alone or together with the special ingredients previously mentioned, into the box. Ignite the maxi oil and make sure its lid is properly secured. Then place it on the acupoints or affected area of the body to be treated. The desired effect is to make the local skin warm and flushed. This method of doing maxi-busing is especially useful for children and other individuals who are afraid of being burnt by an open flame. The last type, other maxi-busing method, except we learn the maxi-busing above. Burning rush maxi-busing, 灯火灸, natural maxi-busing including white mustard seed maxi-busing, garlic mud maxi-busing, and so on. Those specific operations will not be described here one by one. You can study by yourself. Okay. We have learned many methods of maxi-busing. Then we should know what's the function of maxi-busing. The functions of maxi-busing include the following aspects. First, warm the meridians and dispel cold. 灵苏易法方义论 suggested that distension of the zang organs caused by high altitude and the cold weather of the lungs should be treated with moxibustion. From this, we could see that indeed moxibustion can warm the meridians to dispel cold. Clinically, it is indicated for all disease caused by cold obstruction, blood stagnation, and blockages of the meridians, such as cold damp B syndromes, dysmenorrhea, stomachache, epigastric pain, and so on. Second, supporting yang to strengthen the original qi. It is said in 扁鹊心书. 扁鹊is a hearty word. That sickness is caused by the deficiency of qi, the loss of which can result in death. And moxibustion is the first in line to keep it sufficient. Moreover, moxibustion could be used to treat diarrhea, coldness of the extremities. In all, it has been widely applied to many serious diseases due to insufficiency. Thinking of depletion of yang qi. Among them are aneurysms, prolapse of the genitalia, menorrhagia, and chronic diarrhea, just to name a few. Third, remove blood stasis and dissipate pathogenic accumulation. Heat stimulation facilitates the normal flow of qi. The normal circulation of blood is ensured. It dispels blood stasis and dissipates pathogenic accumulation. In the clinical work, it is commonly used to treat disease related to qi and blood stagnation, such as the early stages of acute mastitis and gout. Fourth, prevent disease and maintain health. 扁鹊心书 tells us moxibustion on 关元 CV4 气海 CV6, 命门 CV4 and 中脘 CV12 would be beneficial to us at any time when man is free from illness, although it cannot make us live forever. It will guarantee us over 100 years of age. It is said in Yishuo medical theory, acupuncture and moxibustion. If one wants to stay healthy, score moxibustion on 足三里. ST36 should be continuously applied. Nowadays, it is known as healthy moxibustion, which means maintain the habit by doing moxibustion even though one enjoys good health. This method can invigorate health qi and strengthen the immunity to keep one full of vitality and increase longevity. Okay, that's the end of today's class. See you next time.